But the main symptoms I look for, and I'm going to tell you the whole list. I wrote it down on a whiteboard in front of me. So I'm going to tell you guys the list of the symptoms you should look out for when you're suspecting somebody has a binocular vision dysfunction. So symptoms are blurry vision, unstable vision, like your vision goes in and out of focus, loss of vision, like you feel like your vision just kind of disappears and reappears, colorful lights in your vision, seeing flashing lights that could indicate a pull on the nerves, headaches, migraines. These headaches and strains and pain could be around the area under the eyes, over the eyes, in the forehead, on the temples, and it could even go back. Even the neck pain could be coming from the same issue, because when people have a misalignment, they learn to compensate with their heads all the time, and that of course puts tension on one side, causes pulling on the other side, and creates these neck problems as well. Other types of symptoms are dizziness, feeling nauseous, vertigo, motion sickness, feeling off balance, having to lean on furniture to balance yourself, getting sick from motion, car sickness in the planes, on the boats, being clumsy, having poor coordination, performing poorly in sports, struggling to throw things accurately directly in front of you or catch things accurately, walking into things, walking into people, not being able to walk straight or drive straight, feeling anxious or getting panic attacks, especially in visually stimulating areas like shopping centers and concerts and nightclubs and events, and driving. So feeling frustrated, having fear of certain things like fear of heights, for example, claustrophobia, getting tired, fatigued, exhausted, sleepy, yawning. A lot of this is being caused from this overwhelmness in your visual system, as well as the strain experienced by your muscles. You'll have poor memory, because if you're having a blurry vision of whatever it is that you're looking at or learning about, of course your memory is going to be poor as well. Poor reading comprehension, dislikes reading, skips lines or loses place while reading, has to use a finger, words feel like they're moving around, poor spelling, poor copying, poor eye contact. When someone draws or writes, they can't write on a straight line. They have to kind of lift up on the page or the other direction, depending on the type of misalignment they have. They'll squint or close one eye. They'll notice one eye goes inward, outward, up and down, head tilt, head turn, having to hold things too close or too far. Wow, so many things. And then there's the ocular symptoms that it causes, such as redness, pain, irritation, soreness, heaviness, burning, tearing, and then tension, pulling, pressure, and dull pain. So I believe I said over like 50 possible symptoms, and yes, they could all come from your eyes.